So just before I dive in, I kind of want to reflect on a few things. So I have some slides just to kind of go through what's been going on since COVID-19 began back in the early 2020 in January. We've seen more than 700,000 deaths. This is more than what occurred with the Spanish flu back in 1918, and people's lives are still being lost today. We began to work from home. For many of this was just a huge change in how we were going to be working. No longer were we sitting with our coworkers, hanging out, having a cup of coffee, exchanging ideas. We became Zoom people and staring at our own faces for hours and hours. So it's been a huge transition. And for many of us, we're still working from home. We haven't quite yet returned back to normal days, and we may not. We saw an odd thing happen. We had runs on toilet paper. We had people running around with face masks, or people, wearing full out hazmat gear, going to the grocery store. It was just a very strange time, and everyone was feeling certainly uncertain about what was going to happen next. And it became political. For the first time in many, many years, a healthcare problem became a front stage political fight. People who didn't believe that it was real, that COVID-19 was real, and those that were on the front line trying to let people know that they were dealing with a really serious problem. And so it became political. And the pandemic has halted and delayed 28 million elective surgeries. So when we think about this means that someone who has an acute gallbladder attack can't go in and have their gallbladder removed. For someone who may have had an injury to their shoulder, they can't go in and have that elective surgery, so now they can't work. And even for some people, they delayed going in and getting a biopsy done, which then resulted in them having a cancer that required more extensive surgeries or chemotherapy, or maybe even resulted in death. So this brings us to the topic of moral distress and compassion fatigue. So what is moral distress? Well, it occurs when you know the ethically correct action to take, but you are constrained from taking it. Whether it stems from internal or external factors, moral distress profoundly threatens our core values. It was originally defined by Andrew Jameson, and it started out really with critical care nurses who were seeing patients languish on ventilators or receiving extraordinary care, and knowing that really the outcome was going to be the same. But now it crosses all healthcare settings. We have seen this pop up with physicians, of course, nurses, social workers, and I believe probably patient advocates have been in this sort of situation since the virus began circulating around the country. Compassion fatigue is a condition that's characterized by emotional and physical exhaustion. It leads to your diminished ability to empathize or feel for others. It's often described as the negative cost of caring. Compassion fatigue was originally described by Carla Joynson, who did some studies on ER nurses, and she said that they just had this very unique form of burnout. And then in 1995, Dr. Charles Fidgley, who was a traumatologist, was the one that coined the phrase cost of caring. And it was his work with professional caregivers who are working with traumatized patients he found that they had this unique form of burnout. And it really is more than just burnout. And I'll go into that in just a little bit. But first, we're going to talk more about why moral distress. You know, we've dealt with some very challenging medical issues in the last year and a half that have conflicted our values, our interests, and our perspectives. So if you think about dealing with some of your patients and maybe they're not wanting to get vaccinated, or the physician who may have been concerned about giving vaccines initially, or just, you know, people's interests in wanting certain kinds of medications. And our perspective on what's been going on has gone from one extreme to the other. So all of these things are challenges that we face on a regular basis. And this is kind of what begins to lead us to this whole concept of moral distress. There are 4 levels that we deal with moral distress. Clinical situations. So think about those patients or your clients that you're working with who may want a procedure or a treatment that really isn't going to provide them the benefit that you understand it will, or a physician who wants to do more than you know that the patient really wants to do. And so they're pushing and pushing to get them in for a chemo treatment or radiation, or, you know, some other kinds of surgical procedure. Even end of life decisions that your clients may be facing, and if family members really struggle with that, even though they've all had the conversation that, you know, this is my wish. I really don't want to be on a ventilator. I don't want to have all these things done to me. But in the last minute, the family just can't let go. And here you are as their advocate, trying to get the family to understand that really this is their wish. This is their end of life wish. And so you're going to struggle with those kinds of situations. Not being able to have visitors in the hospital. Patients who had to die alone without family. And you knowing that your patient is now in the hospital in this situation, and you really can't connect with them, which is what your role has been for such a long time. The working conditions, and that, so we know that when COVID-19 hit, we were not prepared to deal with such a large pandemic. We didn't have enough PPE for people. We had working conditions, and particularly long-term care facilities, that were not prepared to deal with people coming and going. And so we saw a large number of deaths in long-term care. And then we shut everything down and we closed the doors. And as a result of that, people were shut off and isolated. Not just those clients that you had maybe in a long-term care facility, but you were shut off, and we all became isolated. And we talk about structural conditions, and I'm not talking about buildings, I'm talking more about organizations. So the policies that hospitals may make that cause the access to healthcare to be really difficult, or even policies that are implemented by our government. So, you know, what medications can we get? I mean, I think we saw that when we started to roll out some of the vaccines, who and when and where. And so all of these conditions create some distress amongst us, knowing that my client really needs to get this vaccine, or my client really needs to be able to get this procedure, but the insurance companies are making me jump through a million hoops just to get that patient to the right doctor or to the right clinic. And then the moral source is our own internal moral convictions, our own beliefs, our own values. And some of that might be impacted by our education or our religious beliefs. So those all play a role in your own moral distress. So if you're struggling with a decision made by your client or maybe by a physician, it really goes against your own values or your own religious beliefs, you're going to really struggle with what you should be doing and what's right for you, or is it right for my client? If we don't address the issue around moral distress, what we end up is with moral residue. And that's what we all carry around with us. And we just never quite get over the situation that happened. So we feel compromised all the time. And we're angry, we're depressed, we're sad because we let this happen. And so it's really important that we address this issue, the situation around moral distress and moral residue, because if we don't, it will just continue to compound and compound. So moral distress is not compassion fatigue, but moral distress can result in compassion fatigue. And compassion fatigue can just occur on its own. So if you're working with clients over an extended period of time, your relationship with them is kind of one of the key components of compassion fatigue. And what does it look like? So it's both burnout and secondary traumatic stress. So when you're burnt out, you feel exhausted, you're depleted, you're just mentally drained, you may feel negatively all day long, you can't get your work done. When you have secondary traumatic stress, so rather, I know most of us probably haven't been exposed to a trauma, but working with a family or a client who may go into the hospital, require maybe resuscitation, which doesn't go well, and you may be there with the family and the patient, that's traumatizing. And it really will kind of sit inside you for a long period of time. And it also mimics PTSD. So when you walk into a certain setting or you're having a conversation and all of a sudden you find yourself feeling just like you did when you were in that moment. So these things together are what create compassion fatigue. It's these underlying beliefs that we have. And those of us that are in healthcare, I think probably think this way a lot. So it's, I must do it alone. Don't ask for help very well. Their needs always come first. So you're always putting your clients and their needs in front of your own. So, and that's very hard sometimes because sometimes it's hard to say no. I don't feel good unless they're getting better. Some of our clients aren't going to get better. They're just not. And that's frustrating because as healthcare people, we want people to get better. That's kind of what our goal is. We want people to get better. And I have to be successful with everyone. We're not going to be successful with everyone. And I'm sure some of you have had clients that you just really haven't worked out very well. They've been a challenge to you. You may have been a challenge to them. But we have this belief that, oh my gosh, if I'm not successful with them, well, then that means I'm not doing my job. I'm just not getting they're not getting what they need. And as a result, I don't get what I need. So compassion fatigue ends up resulting in three components. So we have a physical component, an emotional component, and a spiritual component. So the physical components result in us having things like GI symptoms. So you might develop heartburn. You may have sleepless nights. You can have body aches and pains. You can develop high blood pressure. So all of these physical kinds of complaints that you may be feeling may be that you have compassion fatigue. It's emotional. You feel angry, you feel frustrated, you feel depressed sometimes, you just struggle, you're irritable. So all of these emotional components that you may be feeling on a regular basis, these may be compassion fatigue. And then the spiritual piece of it, it's that sense of hopelessness. Maybe you feel lonely or isolated. So you just aren't connecting with people the way you used to. And that could be that you have compassion fatigue. So there are things that we can do. There are strategies and tools that we can implement. And I think sometimes when we're caught up with things like moral distress or this moral residue or even compassion fatigue, we just feel like there's nothing that we can do. but there are things that we can do. So with moral distress, there are 4 things that we can do. There are the 4 A's. So ask yourself, do I think I have moral distress? I mean, is this situation that I just went through with my client something that I really struggled with? I couldn't get them to see what the doctor was saying, or the doctor was pushing so hard for this treatment that I knew really wasn't going to be successful. Or are your colleagues suffering from moral distress? Are you seeing things in them that may suggest that this is happening? And then you should affirm, yes, it's okay to say, you know what? I think I have moral distress. I think the situation that I just went through just really rode against my core values or the values that I know my patient has. And, and what do I do now? Well, you have a role you can play. So you do need to assess the situation. What really is going on? And what are the actions that you might be able to take? What can be done in the moment? And then you need to ask yourself, am I ready to act? And you may not be, but if you are, you can create a plan and implement it. And sometimes this means spending time talking to your colleagues and letting them know, I had this situation. This is the way I'm feeling about it. This is what I think I need to do. And I'm going to either make an appointment to talk with the physician, or I'm going to sit down with my client and really have that discussion with them about what it is the doctor or the healthcare system is saying. And can we create a plan now to deal with these issues around moral distress? Because if it's happening once, it's probably happening more than once. So really being able to kind of create that plan of action so that the next time you're in a situation, you kind of know what to do next. You know that you need to be, stepping forward and having conversations with your colleagues, with your clients, with your healthcare partners. So learning to speak up. And I know that's often really difficult. I know it can be challenging when you feel like maybe you won't be heard. But if you speak up, then what will happen is that then the message gets sent forward. We do need to be accountable. So we need to show up so that if you have a situation or you're recognizing that there's a situation happening and you have a role in it, you need to be accountable for that piece. The other piece is participating in education. So what you're doing today, learning about the fact that moral distress is an issue that we all are facing right now. So now you kind of know a little bit, and now you'll be able to begin to recognize some of these signs. And then you can look at where is the root cause. Is it within the healthcare system? Is it within the physician practice itself? Is it within your organization or your own, client? So really, what is the cause for this moral distress? And the other piece to it is, because we want to do it alone, we need to involve other people. So you should be involving, the physician, maybe social services within the hospital itself, maybe chaplaincy, maybe you need to bring in a whole group of people to talk about what's going on here. And developing policies. So if you work for an organization, I know some of you are independent, but some of you work within larger organizations. So do you have policies in place that will guide you through what you can do if you have a situation? And if you don't, maybe you need to bring your team together and say, I think we need to develop some policies on how do we deal with a situation that we think is going to cause us some conflicts in our core values, so that you have some steps to take. I think one of the hardest things to do is just not knowing what to do next. And then you can start training others. So the more we learn and the more we share about what's going on and train others, the more likely we are to stop this problem around moral distress, or be able to have a system in place so that if we're set up for a really difficult or challenging client or interaction, that we know what we need to do next, and we're not doing it on our own. So with compassion fatigue, we can actually screen for it. There is a tool called ProQual, which is the Professional Quality of Life tool, and you can get it online. It is included in my references. And it's just a simple test. And what it measures for us is it measures burnout, secondary traumatic distress, and compassion satisfaction. And then it kind of guides you through. Once you've done your score, you can kind of see where you fall, or the people you're working with. Do they have compassion fatigue? Are they scoring in a level where they have high levels of burnout and secondary traumatic distress? And then you can create a program to kind of help work with that. I don't think you should wait to do this until everyone is suffering from compassion fatigue. So there are things that we can do on a regular basis. It should be multifaceted. So it's not just one thing. It's not just you come in and, we all sit around and we meditate, or, we have a little conversation. It should be something that's visual and flexible, but it should be sustainable. So looking within your organization is, are there things you can do on a routine basis that aren't going to really interfere with what everyone does on a daily basis, but it is something that you feel like you can continue to do going forward. And some of those things include peer support, Zens, and minded body. So peer support is a great opportunity for people to get together. When you're sitting in a room with a group of peers and someone says, you know what, I went through that with one of my clients, and this is what we did. And you know what, we got through it, and now we know what to do the next time it happens. You create that emotional connection with each other, especially in this last year and a half when we've been so disconnected. We haven't been able to get together like we used to. There's no coffee time, there's no wine hours after dinner, after a long day of work. So those kinds of connections we've kind of lost. And so how can we bring those back together? Having that concrete support, knowing that, well, you know what, every quarter we're going to all get together and we're going to talk about how we're doing and what's going on. And, being social with each other. Like I said, we have really lost that piece in this last 18 months. And so how do we create social activities again? How do we feel comfortable being around each other again? Because that's something we're all kind of dealing with. When you come into a room full of people, we all sort of have this, oh my gosh, I'm around people again. So there's that little bit of anxiety, but trying to figure out how we can begin to be social again. All those things together really will help over time. And then there's the Zens. So sleep. You need to get some sleep, 7 to 8 hours. Same time, no stimulation. And I know it's really hard because I do it myself. I find myself when I get into bed, all of a sudden I'm like, oh, maybe I better check to see what's going on, check my emails. Did I get something in that I need to deal with right away? We need to turn it off a little bit, about a half an hour before we get ready for bed. You just need to turn that off. Stop watching television, stop checking your Twitter account, quit going on Facebook. Don't worry about your emails. You can't do anything about it until tomorrow anyway. And going to bed at the same time every night, it's amazing how routine your body will get and how much your body really requires that routine. Oops. So exercise, it's not always easy, but 30 minutes, 3 times a week. Get up and move throughout the day. I don't know how many of you have Apple Watches, but mine tells me I have to stand every once in a while. And actually it's a good reminder because I know I can get so focused in on a task and not realize that, gosh, I've been sitting in front of my computer now for 2 or 3 hours. And, my mind is just really drained. If you haven't been exercising, start out slow. Maybe you want to work with a personal trainer. Do you need to go to your doctor and make sure that the exercise program you want to do is great? I will say this much. The one thing the pandemic has done is created a ton of people out there who provide you with free YouTube videos on exercise you can do. Be careful. Some of them are better than others. But it really is important for us to get up, move, and to exercise. We need some strength training. We need some cardio. And so just really try and incorporate that into your daily life. And nutrition. I think we've all been told this, but we need to eat a variety of fruits and vegetables. Things should be colorful that we eat. We need to drink water. Processed foods, and I know that they just came out and said that we really need to reduce the amount of salt that we're getting in our diet because we get too much salt. If you limit processed foods, you're probably going to cut out a lot of that sodium. Try to limit caffeine. I'm not going to tell you not to because I drink coffee in the morning, but I don't drink it throughout the day like I did when I was younger, just because I know then when it comes time to go to sleep at night, I just can't fall asleep. So we really kind of want to reduce the amount of stimulants, avoid those energy drinks. We do know that they can cause you to have irregular heart rates and can be very damaging over time. And then alcohol, it's a drug. I'm going to say, if you're going to have alcohol, just be aware. Am I drinking more than 1 or 2 glasses of wine in the evening? If you use medical marijuana, are you really working with a physician who can help guide you through that piece? But we really need to watch our use of things like alcohol and other drugs, because we do know that when you have compassion fatigue, a lot of times you're going to maybe reach for those things that you think are going to help reduce or alleviate some of those stressors. And when it comes to spirituality, if you have a religion, are you still practicing? I know it's been very hard. Most churches, had to close things down. Many of them are now reopening. A lot of them have Zoom services, but are you practicing your religion? Try to get back to that if you have one. Connect with nature. There are so many studies out there right now that tell us that 2 hours of nature every week helps to reduce cortisol levels and reduces stress. So if you can go out for a quick walk a couple times a week, go to a forest preserve. I actually live in Sedona, so I'm very lucky. I have a lot of great nature around me. I try to get out as often as I can. Take time with family and friends. When we develop compassion fatigue, we tend to withdraw. We don't really want to socialize, but getting those connections, that's so important. And your friends and family want to support you. So if you tell them, look, let's spend some quality time. Let's play some cards, let's, go for a hike together, or, we can get together for dinner, hopefully in an outdoor setting right now. And be relational, have relationships with people. I know it's been really hard when we do everything on Zoom and you spend most of the day staring at your own face, and all of a sudden you feel like you don't have a real connection with anybody, but maybe your own face, so maybe setting up some time to talk on the phone, getting together for coffee. As we ease back into a more normal lifestyle, which I think is going to take us longer than we anticipated, try to remember to be relational. Hello, how are you? And when someone asks you how you're doing, can you be honest about how you feel today? Oh, I'm really struggling today. It's been a rough week. Or, what, this has been the best week I've had in forever. How are you doing? And have that real conversation. I know we struggle with it right now, I think, because we've been so disconnected. And mind and body. If you don't know how to diaphragmatically breathe, I'm happy to give you a quick course. It's very simple. So if you put your hands on either side of your ribs and breathe in and breathe out, when you breathe with your diaphragm, your ribs should expand out and then they should go back in as you exhale. The reason why we want to breathe with our diaphragm is it suppresses our parasympathetic nervous system because it presses on the vagus nerve. And what that will do is it'll slow down your heart rate. It'll slow down, your breathing slows down, and your whole stress system will slow down. Using guided relaxation and meditation. If you haven't learned how to meditate, there are a million apps out there, as well as for guided relaxation. There's things like Calm. They're just every day, I think there's a new one out there, but find one that you can use. And meditation doesn't have to be a real formal thing. I think the Dalai Lama will tell you he meditates for 5 hours every day. He said, but for you, maybe 10 minutes because you have a life. My job is to meditate. Your job is others. So, if you want to learn how to meditate, just do something very simple, very slow, 5 minutes a day, just sitting comfortably. You don't have to sit on the floor on a cushion. You can sit in a chair, close your eyes, just breathe slowly. And don't worry about what's going on inside of your mind. Your mind never stops working. You're constantly thinking of things, and you just need to just watch them like a movie. Let them just flow past you. And after a while, you'll begin to kind of settle in and be okay with all those thoughts that just keep coming up and coming up and coming up. And if you find that you can't let go of them, well, then you just kind of count. So when you're sitting in your quiet, comfortable seat, you count 1 to 10 and then 10 to 1. And if you find your mind has just wandered away, well, just come back to that counting again. And it will help you over time to kind of develop this ability to be calm in just a few moments. And what we do know is that by doing things like the diaphragmatic breathing, doing guided relaxation and meditation will help reduce our stress hormones. We will lower our blood pressure. We will find ourselves being less anxious. You may even sleep better at night, and you may be even more focused throughout the day. So just some simple things that we can do. Like I said, when you create a plan, what you should probably do is think about, well, what can I do on an ongoing basis? What can I commit to? So develop that, clear expectations like, well, I can't do it all. Well, no one can, but are there 2 or 3 things you can do? Is maybe cutting out some of the caffeine later in the afternoon, going for a walk, for 30 minutes and sitting quietly in meditation for 5 to 10 minutes. I can do those. So you're going to commit to that plan. So say you're going to do it for 30 days. I would absolutely say kind of keep some notes, mental notes, or if you journal, absolutely journal and see where you are in 30 days. Do you find that you're able to concentrate more? Set boundaries. It's very hard sometimes to say no, especially when you feel like you are the one that has to make everything correct and right. So, but learning how to say no, or saying, you know what, I can't do it now, but I can do it later. Those are really, really important. And the other thing is remembering it's not a sprint. This is a marathon. And for those of you who just watched the Boston Marathon the other day, you saw some people really struggle, but they got through to the end of the marathon. It may have taken them over 4 hours, but they did it. So we just need to be, just a little bit more persistent and planning. So all of these things that I talked about for the compassion fatigue really can also help you deal with the moral distress, because we do know that along with moral distress, we can feel anxious and angry and depressed and sad. So these kinds of things can be worked in a combination together. So like I said, these are my references. I did include the website for the Professional Quality of Life Survey. I do suggest you go and you can download it, take it. There's an answer sheet so you can kind of see where your score is, and look at that. And if you find that your score is fairly high, that you're scoring high in both of those secondary traumatic stress and burnout, then you really need to certainly address these issues. If you have listened to this lecture and you find that maybe I have moral distress, I've had these situations, then it's time to address those, because if you don't, you'll be left with that residue. And that is a long-standing kind of problem, and we need to address that, and working with your colleagues. So that's my lecture.